Today's video comes from KevD31, and this is perfect as I just finished revising cardiology for my final exams. So if you have a question about medicine you want me to make a video about, let me know in the comment section below. Okay, now let's get moving. So today I'll be talking about what is hypertension, its symptoms and the treatment options of hypertension or high blood pressure. For most healthy people, their blood pressure can be between 90 and 119 for systolic pressure and 60 to 79 for diastolic pressure. Pre-hypertension is from 120 to 139 systolic pressure and 80 to 89 diastolic pressure. Very briefly, the systolic pressure is the maximum pressure in your arteries after the heart contracts, and the diastolic pressure is the minimum when your heart is resting between beats. NICE defines hypertension as a clinical reading that is persistently above 140/90 or a 24-hour blood pressure that averages 135/85. Patients with hypertension can be divided into two groups. The vast majority of people, roughly 90 to 95%, fall into the first category. This category is known as primary or essential hypertension. In this type of hypertension, there isn't an identifiable cause for the rise of blood pressure, but rather it's because of the changes that happen as we all age. But other than age, it is known that certain lifestyle choices such as being obese, eating a diet high in salt, and living a sedentary lifestyle are all risk factors for developing primary hypertension. The second group is known as secondary hypertension, and it's mainly caused by the endocrine and renal systems. However, there are various other causes as well. Here's a table that shows some of the conditions that may lead to secondary hypertension. I will not be able to go through all of them in this video, or it will be like a couple of hours long. But I will go through some of them in the future, and some of them, like the contraceptive pill, I've covered in earlier videos. Now moving on to the symptoms and signs. In most cases, people with hypertension only experience symptoms once they've reached a very high blood pressure. Normally pressure is greater than 200/120. This is why hypertension is known as the silent killer, as it causes damage to the body without the patient realizing it. Speaking of which, why is high blood pressure so dangerous?
足をポンプにして血の流れを加速させている。常人の体ならば心臓が張り裂けるほどの血圧にも内臓も血管も全てがゴムならば耐えられるゴム人間ならではの技だ。
Well said, Rob Lucci. I couldn't agree more. Unlike Luffy here, we mere mortals don't have rubber blood vessels and organs, so high blood pressure causes damage to the endothelial cells that line the inside of the blood vessels. Fats from your diet can collect in these damaged areas, causing the blood vessels to become narrow, and thus allow less blood to get to wherever the vessel was leading to. The constant pressure can cause parts of the artery to weaken and bulge out. This is known as an aneurysm. Aneurysms can potentially rupture and lead to life-threatening bleeding. High blood pressure also damages your heart, your brain, your kidneys, and your eyes. Now, when assessing a patient for newly diagnosed hypertension, you need to check that there is no damage to the organs mentioned above. 3 investigations that need to be done are fundoscopy to check for any retinopathy, urine dipstick to check for any renal disease, ECG to check for left ventricular hypertrophy and ischemic heart disease, HbA1c to check for diabetes, as it's an important risk factor for cardiovascular disease, and check for lipids for similar reasons. Now lastly, I'll be talking about how to manage someone with hypertension. Essential hypertension is not curable, so patients need long-term treatments. The goal of the treatment is to get the blood pressure below 140/90. However, in diabetes, the goal is to get below 130/80, and in patients that are over 80 years old, the goal is to get below 150/90. The first thing that's usually done is advice about lifestyle changes, such as reducing your salt intake, eating more fruits, veg, and whole grains, exercising more, at least 30 minutes a day, and if you're obese, to try to lose weight, with the goal being a waist size of less than 102 centimeters for men and less than 88 centimeters for women. A huge lifestyle change is to stop smoking and to reduce alcohol consumption as well. In terms of medication, the main class I'll speak about are diuretics, ACE inhibitors, angiotensin II receptor antagonists, and calcium channel blockers. Blood pressure is calculated as flow, that is the volume of fluid in your vessels, times resistance. So higher flow or higher resistance leads to higher blood pressure. As a result, most blood pressure medications work to lower either flow or resistance, and thus lower blood pressure. Thiazide diuretics work by increasing the excretion of sodium and water in your kidneys, so you have less fluid in your vessels and your blood pressure goes down. ACE inhibitors interfere with the renin-angiotensin-aldosterone system. They stop the formation of angiotensin II, which is a vasoconstrictor. Not only that, but without angiotensin II there is less aldosterone, which normally helps to retain sodium and water. So ACE inhibitors lower resistance and flow. Angiotensin II receptor blockers work in a very similar way to ACE inhibitors, but rather than stop the formation of angiotensin II, they block the receptors for angiotensin II. Calcium channel blockers block the channels in the smooth muscles of your blood vessels. Calcium normally causes these vessels to contract, so if they're blocked, the vessel will relax and have a lower resistance. Treatment depends on the patient. If the patient is under 55 years old, then you can start off with step 1 treatment. This involves the use of an ACE inhibitor. If the patient can't take an ACE inhibitor for any reason, for example if they have a cough, then you can use an angiotensin receptor antagonist instead. However, it's important to know that you can never combine both these medications in treating hypertension. If the patient is over 55 years old, or is black, then give a calcium channel blocker. And if they can't take that because of something like edema or suspected heart failure, then you can give a thiazide-like diuretic as a substitute. If that doesn't reduce blood pressure, then it's time to move on to step 2, which is using a calcium channel blocker with either an ACE inhibitor or an angiotensin receptor blocker. For step 3 treatment, 3 drugs are needed, and the combination is either an ACE inhibitor or an angiotensin receptor blocker, and then once you've picked one of those two, you add a calcium channel blocker and a thiazide-like diuretic as well. Here is a table from past medicine that nicely sums up the management options. If you have any questions about the side effects of the drugs used or their mechanism of action, then ask in the comment section below and I'll be sure to answer. Sorry I didn't include all of them, I didn't want the video to be too long. Anyway, like, share and subscribe if you enjoyed the video. Thanks for watching and I hope you're having a phenomenal day.